Welcome to this 14 Fish Facebook Live. The AKT exam's just 2 weeks away, so I've put together a few tips, slightly different from the last video, to see whether we can absolutely maximize your score. Firstly, I just wanted to say if you've been working today, then it was incredibly busy, so high five to you. But and I hope you weren't as busy as I was in Cedra. I've literally just run in time to do this. Some of you may be catching this on video. So you've only got 2 weeks to go, so you're going to absolutely have to focus and maximize your revision. And so every point that in the exam at this particular juncture is really important, because 1 or 2 marks may make the difference between you passing and failing. So my name's Mark Coombe, and I've been an examiner for the last 20 years. I've helped thousands of candidates through both the AKT and CSA exam. And tonight, some of you will already know Liz, who runs the AKT and CSA packages in 14 Fish offices, and you may well have corresponded to her or with her. And so she's going to be doing a bit more work tonight, so that Dr. Phil in the office is happy that we're changing the format. Anyway, so the first thing to say, just a quick statement would be to say that what you must do is learn the stuff you don't know. And I know that sounds stupid, but how do you know what you don't know? And you've either got to assess yourself, so you've got to do some questions. So come and do one of our 100 item AKTs, which automatically has feedback, or you're going to have to look through little aspects of general practice and identify the areas that you've either forgotten or you don't like because you avoid them in general practice, or you find difficult. There are always certain things. So there are certain patients. I've been in practice for quite some time now, and there are certainly some patients that I just can never remember their name. And there are certainly some parts of certain illnesses that I really struggle with. And so you probably know those too, and it's important now to identify them in the next 2 weeks, because those are the things that are worth looking up. So what else could you do? You can join our AKT forum. We've got an amazing AKT forum at the moment who are summarizing the different aspects of the BNF. For those of you who haven't seen the BNF, it's changed quite significantly. And so summarizing it is a matter of identifying different areas for you to divide in your group so that you can all then get that summary and share it with each other. And so that learning of the new guidance that's covered in the BNF is done. You do need to look at the RCGP feedback, and I'm going to talk you through that. Liz and I are going to do that in just a second. And equally, it's worth going to the essential knowledge updates and just having a look through those. I mean, there is quite a lot of politics in Central College literature, and that is because a lot of areas have to be covered. In the exam, you're going to be asked common things in general practice, and so you can skip over essential knowledge updates that sound unrelevant to general practice or more relevant to secondary care. You're much more in the exam going to get stuff about multiple unexplained symptomatology or upper respiratory tract infections or early detection of cancer, and we'll perhaps cover that a little bit more at the end. So let's have a look at the last AKT exam feedback and how you might use that to help you. So this is the feedback from AKT 32, which was on the 31st of January 2018. And think to yourself, as we discuss this, what is it that you don't know about it? So what is it that you're going to revise? But also, if you were the examiner, how easy is it to write a question about it? Because if there's a question which has got multiple answers, it's not an easy one to do. So if there's a topic or a subject area where you can write a very clear question, then that's going to be the sort that comes in the exam. So Liz isn't going to thank me hugely for getting her to say lots of long medical words, but we'll give it a go, and I'll just try and talk it through as if you were here with us as well. So where are we going to start?
So we're just going to start with candidates are reminded that the AKT tests for appropriate and cost-effective management. So sometimes the correct answer is not to investigate or not to prescribe or refer. candidates find this option a difficult one to choose, as it's sometimes the case in clinical practice.
Okay, so the vast majority of you have spent most of your time in UK hospital-based practice, and as a result, then you're very much used to diagnosing and intervening. So it's really important that if there is an option on there that in general practice, actually you wouldn't refer. So you wouldn't refer a patient for tonsillitis. You wouldn't refer somebody, who had a very distinct, a young person who had a very distinct history of dyspepsia. You would treat them first rather than refer them. So don't think like a hospital doctor, think like a GP.
So moving on to some questions may relate to clinical situations such as management of mildly abnormal blood test results. As described above, it may be that significant additional testing is not required, and this may be the correct answer option.
Yeah, so there are a number of questions, particularly about kids, where actually the right answer is to reassure and review. And so similarly, if you saw somebody with a normal set of bloods or a marginal macrocytosis, you would probably repeat the test in a month, or you certainly wouldn't be referring, or you certainly wouldn't be doing a massive intervention. So don't be scared of the doing nothing option, because that's an important test of general practice. So dealing with uncertainty is a clear message that we would certainly want our trainees to be able to do, so that they're fit for independent practice, which is what the exam's all about.
So the next paragraph is just about improvements, really. So
so these are parts of the exam where people had struggled before, but they're now improved in. And the important key is that if all of you get a question right, then it's not a good question. It's not going to discriminate particularly well. And so in areas of improvement, so where people have done a lot better in, there are likely to be less questions, because they don't discriminate between the passing and failing candidates. But let's quickly go through what are the topics that people improved on last time.
So a number of areas concerning child health, including behavioural problems, joint pain and safeguarding.
Okay.
Neurological problems such as motor neuron disease and also pain management. Contraceptive problems, including being aware of when pregnancy might be an underlying cause of symptoms, and diagnosis of acute, serious but rare problems such as meningitis.
Okay, so that's important. So there are probably some topics there that I wouldn't now be revising in the 2 weeks before the exam, because it's a lot less likely that they're going to come up. Out of all of those topics that Liz has just read out, then probably meningitis, serious but rare conditions that if we miss cause catastrophic effects. But don't forget what's been topical recently. So measles, scarlet fever, we've had influenza epidemics. All three of those have been, very, very common since about November. Your exam for 2 weeks' time will have been redone or set properly in March. So lots of good topical stuff from end of 2017, 2018 are going to be in this exam.
So the next bit's just going on to areas that are causing candidates difficulty in the exam. So previously examiners were disappointed to note that on yet a further occasion, candidates struggled significantly with simple drug dose calculations.
Yes, so this is something that candidates weren't quite expecting. We added about 40 drug dose calculations onto our AKT package about a couple of weeks ago. And they're going to be fairly straightforward, but it's going to be, by and large, a child's weight, and they're expected to have so many milligrams per kilogram of a particular drug, say amoxicillin or any drug really, and then it's just a matter of working out exactly what they need. If you don't know how to do it, get someone to help you. Have a look at the stuff that we've got on our question bank. Have a look at working out units of alcohol by absolute volume. So I'm sure you're all completely aware that it's the number of mils times the percentage absolute volume divided by 1,000, because that was very topical. Department of Health came up with some different guidance on alcohol intake and alcohol advice, and so you might well get calculations in that area, but there are certainly at least 5, but maybe a few more drug calculations. There is a calculator. If you look at the top left-hand side of the screen, you can move your mouse across and use the calculator, but by and large, the numbers will be round numbers, 5, 10, 5.2. They are not going to have multiple numbers after the decimal point. If you're finding that you've got a number like that, it's probably wrong. And in the same way, if you're working out drug dosage in the surgery, if the number seems completely wrong, you know, you're giving a child 30 mils of antibiotic 3 times a day, there is something wrong there, and you need to go back and work it out again.
So another area was candidates having an awareness of common ethical concepts and understanding how these are relevant in a range of clinical scenarios.
Okay, and this is something you get with experience, and this is something that it helps if you can discuss it with your colleagues at work. But a quick revision aid, so in the next 2 weeks, I'll be going to the Bradford VTS site. So just Google Bradford VTS, Vocational Training Scheme, and have a look at their ethics section. There's some really good stuff on there and some good dilemmas and the sort of thing that are likely to come up.
It was also noted that some administration questions were not answered well, including those concerning access to medical records. Okay,
so over the last few years, the administrative questions, administration and stats, people have done better than they have done in clinical. But this exam is the first time that turned round. And so administration was the poorest scorer of all the candidates who sat the AKT in January. So think about your administration in practice, think about access to Medical Records Act, that's going to come up again, and think about, don't forget your DVLA stuff, you know, fitness to drive at a glance, and how long after certain conditions can you drive. So how long after a heart attack or a stent implant or a stroke? This is important stuff because we need to know it for our patients.
So candidates should have a high level of awareness of symptoms and signs which might indicate that cancer is a possible underlying diagnosis.
Okay, so massively topical. It's even in the news today. Is all about early detection of cancer and the setting up of these early detection units. The RCGP have run a number of different campaigns. And so if you don't know about the CAPER studies or the RATs, which is the risk assessment tools, and at what percentage you should be referring, you need to look those up. It's very easy to look them up, just cancer.co.uk, but have a look at the risk assessment tools done by a GP. So these were originally done by a guy called Prof Hamilton up in Exeter, who's a professor of general practice. So really good stuff, very relevant to us, and it's those symptoms that help us pick things up in general practice, and they're covered in a number of the cancer modules on the library.
Equally, as with day-to-day clinical practice, descriptions of physical symptoms may not have a physical diagnosis, but perhaps be of psychological origin. That's a mouthful. So,
that's tough. So these are things like, presentation of multiple unexpected symptomatology. We've got a module that's worth looking at. There's a list on that module which go through the classic list of diseases, and we're talking about fibromyalgia, chronic fatigue, chronic low back pain, irritable bowel syndrome, chronic headache, all of that sort of stuff. There are some classic parts of the description of a patient with that sort of feature, and so we're going to try in the exam to give you a classic description. We don't want to give you lots of distractors. So in the stem of the question, it's going to give you a classic description of something like irritable bowel. It'll be the classic age group. It won't be a high risk group. It's going to be, the classic symptoms. So have a look at those. Have a look at that list and just think to yourself, if I was going to write down a couple of sentences that would describe somebody with fibromyalgia, with irritable bowel, that's definitely worth looking at, because those are the sort of outline descriptions you're going to get, and then say what's the most likely diagnosis.
So just some overall feedback from the last year, patient safety and quality of care. This relates to prescribing, in particular, drug dose and calculations. Yeah,
and so patient safety, the biggest, you ask any of your doctors in your practice, the patient safety, the biggest thing is prescribing, and some of the stuff that we prescribe regularly, like warfarin, methotrexate, poisonous drugs. And if we get the dose wrong, and if we don't monitor them, the DMARDs, if we don't monitor them properly, then our patient's going to come a cropper. And it's the biggest patient safety issue in general practice, and it will be in the exam.
Another area is healthy people promoting health and preventing disease. This concerns, in particular, vaccination schedules and recommendations.
Yeah, so vaccination schedules, because they're set, they do change, and they have changed relatively recently. They're all covered in our vaccination module, but it's very, very easy for me to say at preschool which of the following vaccines would be given, and so you just need to learn those. And there's some great tables. There's a couple of really important tables. We've got them on the module, vaccination module, but they're in the green book. You need to know that, and you probably need to know that the night before. You're going to say to me that that actually you don't need to know that, you can look it up, or actually your practice nurses do it. Well, you're responsible for those vaccines, so for your exam, we're going to expect you to know them, and there will be questions on vaccinations.
Respiratory health. The main topic concerned here is asthma, which is complicated by nationally conflicting guidance.
Yeah, so we had to put out a module quite quickly about a month or so ago, looking at the difference between NICE and SIGN, because for the first time really, a number of people were surprised that there was a significant difference. Now, NICE is quite aspirational, in that we don't have a pheno machine in my surgery, and I don't know anybody else that has got one. So you need to know what NICE are saying and what SIGN are saying, and it might well ask you, this is what NICE says and this is what SIGN says. So a lot of people on the AKT forum have said, which one should we learn? Well, actually, you need to know both, and you probably need to know the difference between the two, because that's the important thing. In day-to-day practice, I'm still rattling along with SIGN, but that's not what they're asking in the exam. It's what do each of them say. So big module on the library. Make sure that you have a look at it.
Cool. I'm not sure if anybody who's watching has got any questions for Mark about the AKT coming up, or how to prepare in the last 2 weeks. Anything he hasn't covered?
One thing we didn't cover, which we covered in the last AKT live, was exam technique. There's a big section on that, but biggest thing I would say is whatever you do, make sure that you finish, make sure that you review properly. If you don't know what that means, go on the package, have a look at how to review, do a 100-item AKT and look at your reviewing, because you're either a negative, a neutral, or a positive reviewer, and we'll help you work that out.
And if you want to see any more of our older videos, so we've done a few AKT and CSA live videos now on Facebook, you can just go to our Facebook page and go to our videos option, and you'll see all of the old ones through there, and Mark covers everything.
Well,
everything you need to know.
But anyway, I hope you liked a change in format. I think it's quite useful to go through something like that and think to yourself, well, what are the sort of things that are going to come up? There's loads of great topics there for you to look at. If you know them all, that's brilliant. And once again, don't forget to do your stats formula the night before. And really good luck to everybody who's sitting. Thanks for all the brilliant feedback you've been giving us on the package. We're going to work really, really hard to make sure that we keep the sort of standard that we've got, give you all the new stuff that you need. And we'll see you in the CSA package or afterwards. You've been, as I say, great so far. So really good luck in a couple of weeks' time.
Thank you.
Bye.